The ride of your life is daddyhood.
For those of you who cannot wait and love daddyhood, please head over to our Patreon. We have exclusive access to episodes, we have early access to episodes, and we have behind the scenes footage. Head on over there, sign up, be part of the exclusive daddyhood group, and join us over there. Welcome back to Daddyhood. Today's episode I'm so excited for. Dr. Gonzalez, welcome to Daddyhood.
Thank you. Thanks for having me.
Today we are talking about sex ed in the 21st century, a topic that I've been squeamish around before, and I know a lot of people tend to not want to talk about. But now that I've been through the fertility process, I now understand the importance of it. Mm-hmm. So having you on to talk about this in an adult fashion and way, I think is going to help so many people. So
Great.
Thank you.
Yeah, I'm excited.
Before we get into it, your bio. Dr. Gonzalez is a board-certified urologist who is fellowship trained in sexual medicine and specializes in the management of male and female sexual dysfunctions. He is a co-founder of Popstar Labs, a sexual wellness brand focused on promoting the importance of sexual health for all. Dr. Gonzalez completed his medical education at Columbia University and his urology residency at Mount Sinai Medical Center. Throughout his career, Dr. Gonzalez has focused on advocating for sexual health and providing improved healthcare to the LGBTQ+ community. Dr. Gonzalez serves as an official sexual health advisor to Astroglide Lubricants. He has served on the board of directors for the International Society for the Study of Women's Sexual Health. He has appeared on the Doctors television show, has been featured in Vogue magazine, and is a medical contributor to Men's Health, Cosmopolitan, and Oprah magazines. Dr. Gonzalez continues to build a robust following on his Instagram and TikTok, where he uses social media to educate the public on sexual health. What is your at? Little thing.
At Joshua Gonzalez, MD.
At Joshua Gonzalez, MD. Welcome to Daddyhood.
Thank you.
What a bio.
I mean, yeah, I'm impressed you got through all that.
Oh, it's really impressive. Before we get into it, I like to warm up with a dad joke. So if you will entertain me here for a second.
Let's go.
Dr. Gonzalez, what did the grape say when it got stepped on?
Squish.
Close. He said nothing. He just let out a little wine. Good one.
I like it.
Okay, so this topic in this episode, in my mind, I've been thinking, how can we do this? How can we do this? And then all of a sudden, come across your content. And I'm like, this is how we need to break things down. Mm-hmm. And for those not familiar, go to his Instagram, take a look at the videos he makes. I think there's so many different topics that we can get into, but I want to talk about it because I, for one, feel like I was let down by our educational system. Mm-hmm. I was part both of a private grade school. I went to a Catholic grade school, then transferred to a public, and I could say neither did a good job with sexual education. And it was sort of like a joke and a scare tactic, mm-hmm. in my opinion, of like how they approached it. Why do you think schools are doing that? And I say that because they're leaving out the best and most important part, which is the science and the data behind the whole point of your reproductive organs.
Right.
So why do you think that is?
I mean, I think it just starts from a societal stigma around sex, right? Where we have this society that both glorifies sex in media, and we're constantly inundated with, sexual imagery, video, and at the same time, we want it to exist in this sort of fantasy space, and we don't want to talk about, the realities of sex, the biology of sex, the psychology of sex, and so I think that that translates to how we educate our children. Surprisingly, I went through 4 years of medical school, and we get almost no sex education in medical school, and we're physicians. We're trained to talk to people about all kinds of body parts and all kinds of biological, happenings. And we got very, very limited exposure to sexual health. It's something that after going through residency, I found an interest in, and so I kind of had to seek it out
Yeah.
and do an extra fellowship in sexual medicine to learn all about it. So even
at that highest level of education.
Yeah. And you would think, I'm a urologist, that we deal with men's private parts. You would think that would be a big part of our education, and it really wasn't. And so, it's not just a problem in grade school and in junior high and in high school. It's all the way through the medical education system that we're doing a really poor job of educating people and their providers about sex.
Yeah. And I think there's so many micro topics within the topic of sex ed, right?
Mm-hmm.
I mean, obviously, pleasure and the function of our reproductive organs and like what we use them for, but also for different communities, like the LGBTQ plus issues that are within the sex ed, consent is another big one too, that I feel like is always sort of let down. In the perfect world, how do you think, I guess two questions, when would you like to see this introduced and maybe phased, or, how would you, in the perfect world, as like a doctor and somebody who specialized in this, when would you like to see this sort of introduced in the education system?
I mean, in my perfect world, it would start, in elementary school, teaching kids about their body parts and not making it a shameful thing, being able to say words like penis or vulva, and having them understand that this is just another part of their body and it serves a very specific function. And from there you build, you teach kids about how to have safe sex, how to prevent unwanted pregnancies. And then maybe the next layer beyond that is, how do you enjoy sex, right? Because so much of what we get in junior high and high school is about like, don't do this or you're going to get an STD. Don't do this, you're going to get somebody pregnant. Those things are important. We want people to have, knowledge so that they don't get pregnant when they don't want to. But there's never a conversation about pleasure. So that's left for people to kind of figure out on their own and talk to their friends and, watch TV and get it through media. But those aren't real examples of sexual pleasure, right? So people are kind of left to figure it out for themselves. And I think that we could do a much better job of teaching people how to figure out what feels good to them first, and then be able to communicate that with a partner so that they have better sex.
Totally.
Yeah.
And I think for me too, just like my experience is like coming out, I always knew I was different at a young age. And then I didn't really knew what that meant until puberty. Mm-hmm. So like right around that time, I was like, oh, this is why I felt different my entire life. I'm more attracted to this. Mm-hmm. And by that time it was too late. And then also within that, I'm like confused during any sexual education course because they don't talk about gay sex.
Yeah.
Or the risks,
right?
Which you would think would be the opposite, where they would talk to you more about and I say this because just of what our previous generation had to go through with AIDS and HIV. Mm-hmm. They would start there, right? They would actually want to educate and talk about the history of what we've been through as a society.
Yeah,
it's just so it's fascinating to me that we sort of leave that part out.
Yeah, I mean, I think in a weird way, I think my guess would be that people avoid talking about these topics because they think that somehow they would be condoning them. But there's people that argue against vaccinating kids against HPV. I mean, this is a vaccine that has been proven to prevent cervical cancer and prevent penile cancers. Like, if you think about it from that perspective, why would you not want to protect your child from getting a genital cancer, right? That could end their life. But people think of it as, oh, HPV, that's a sexually transmitted disease. If I vaccinate my kid with this, it's condoning them to have sex. And the reality is they're going to have sex anyway. So why not give them the tools to best protect themselves? And when you're talking about, LGBTQ plus individuals, you're right. There's no mention of non-heterosexual types of sex, right? It's all about pregnancy and how to prevent that. But going back to what I said earlier, that extends into the medical education system. There was a study that came out a few years ago looking at medical schools in the US and Canada, and the median number of hours in a 4-year education that were devoted to LGBTQ plus topics was 5 hours total across 4 years.
Across 4 years.
Across 4 years. And that was all LGBTQ plus topics. So that was sex and HIV and, everything that you can imagine that would be applicable to an LGBTQ plus individual.
Yeah.
They only got 5 hours in medical school. So we're really, this is a systemic problem, really.
Right.
You know,
I mean, that's 5 hours is a very fascinating, like compared to the percentage of the populations on those campuses that identifies LGBTQ plus AI, like all of those, 5 hours is wildly low.
Yeah,
I think.
Yeah.
All right. So I want to get into a urologist.
Mm-hmm.
So on a day-to-day basis, somebody walks into your office. What are they there for?
So I like to say I'm not a regular urologist. I'm a cool urologist because I focus on sexual health.
Yeah. I mean, your nickname, can we just say your nickname?
What is that?
Is it the Dick
Oh,
Doctor?
the Dick Doc. Yeah.
Okay.
Yeah.
All right. I was like, wait, did I make
sure,
this up in
no,
my head?
I wasn't sure if we were allowed
You're
to
like, are we going
say
there?
that word. Okay.
Oh, yeah.
All right, cool.
It's a podcast. We can say
Great.
anything.
Love that. Yeah. So I see, people who have sexual health issues. The main things that I come into contact with day to day are erectile dysfunction, low sexual desire, hormone issues. So I treat men with testosterone or other treatments to increase their testosterone. I do a lot of hormone replacement therapy for women in perimenopause and menopause. I see younger women who have pain with sex, sometimes related to birth control use. That's a lot of what I see on a day-to-day basis is just kind of helping people have better sex. They're seeing me because they're not having a fulfilling sex life for one reason or another. And it's sort of my job to diagnose what that problem is and then provide them solutions.
Has anything changed over the last few years since you've had patients coming in? Like, is the problem getting better? Is it getting worse? Is it becoming different? Or is it still all about the same?
I mean, I think in terms of the percentages of people coming in, if you look at the data that have been published on like men's sexual health, for instance, like I think you've talked about this on the podcast before, but the rates of sperm, right? Like the sperm counts are going down globally. They've dropped by like 40% in the last 50 years, but that's one symptom of a global problem related to men's sexual health. So we're seeing higher incidences of erectile dysfunction, of low testosterone. And people don't know, we talk about ED and you think of it as like that Bob Dole commercial from the 90s. It's like an old guy who can't get an erection. But the data, show that it's a pretty common problem. Like 30% of guys in their 30s have experienced it, 40% in their 40s, 50% in their 50s, and it goes up by about 10% each decade.
Wow.
So it's a very common problem. I think with the advent of social media and the internet and people finding forums and kind of being able to do their own research, we're seeing more and more younger patients come in like looking for solutions. Whereas, historically they may have felt too ashamed or embarrassed to say anything to their doctor or not known where to start. And many of those people find me on their own. They don't like tell their primary doctor and then get referred to me. They're like, oh, I saw you on social media. I saw you on Google and you seemed like a good fit for me and I want help with this.
They find you in a safe space.
Exactly.
Yeah, it's so interesting because, I was just thinking like if I struggled with something like that, I would probably try my own research online and just order products online instead of going to my doctor which obviously now I don't feel that same way, but I just know when I was closeted and or when I, people don't like, it's an uncomfortable conversation to have even with a doctor who you're protected with.
Yeah.
I mean,
again, going back to this medical education like piece, right? So one of my missions in my practice is to kind of be an advocate for people in my community, right? I'm gay and I recognize as a gay man that it's not always comfortable having these conversations around gay sex with your provider unless you're lucky enough to have a queer provider, right? Yes. So like that understands that, but that's not the reality for a lot of, gay people and queer people. And so being that resource for them, I think is really helpful. Thankfully we live in a place like LA where there are a lot of queer providers and people do have access to that, but that's not the case a lot of places in the country.
Totally. And you hit on something that I want to go back to too. Part of your job and your scope of work for your patients is hormone therapy and prescribing TRT. I've said this and I'll say it again, like I've been on TRT and it was great for, when I needed it and what I was on it for. But when I was on it, I never sort of was laid out with the facts of what it can do to me as far as my reproductive health.
Right.
They sort of told me it was going to possibly have some acne, some mood swings. They never said your fertility numbers will plummet if you take this. And I not that I would have made the decision solely off of that. I just would have loved to have that presented to me.
Yeah.
So that's something you talk to all your clients about?
Yeah, absolutely. Anytime I see anybody, it really doesn't matter their age. I mean, it could be a guy in his mid 50s who maybe has kids that are in their teenage years. I always ask, do you have any desire for kids in the future? Because I never want to make assumptions. Or I have gay male patients who came out late in life. Maybe they've married and had kids with a previous partner and they came out in their mid 40s or in their 50s. And, I don't want to shut that door for anyone by making an assumption. And unfortunately, I think that happens a lot, especially to gay guys who need some sort of hormone therapy. I'm not arguing that they shouldn't be on something, but like you're saying, either they should be offered alternatives or be given the information first so that they can make an informed decision.
I love that because, that is so true that I'm assuming most doctors, especially if they're not in our own community and they're treating a gay man, would just assume that kids aren't in their future.
Yeah, no, it happens.
And
way
so
more
they
than
don't
you
even
think.
want to disclose the fertility side effects.
Right. Yeah.
Wow.
Yeah.
So let's get into Popstar.
Okay.
What inspired you to create it?
Yeah.
And, as far as like your product line goes and then, future products and, I love the business side of things too.
Yeah.
So you see this opportunity and you're like, why not me?
Yeah. It sort of started as like a pandemic project. Early in the pandemic, when not a lot of people were going to the doctor, I had a lot of time on my hands and had been seeing a lot of younger patients, a lot of my younger gay male patients who were complaining or asking for a solution to an ejaculatory health problem, essentially wanting to understand how they could make their loads bigger, right? Because we know that if you ejaculate more volume, your orgasms tend to be more intense. And for a variety of reasons, people can have declining ejaculatory volume. And so there really wasn't a supplement that I thought was like safe and effective. And called up my business partner one day and I was like, I have this crazy idea. What if we like develop a product that makes your ejaculatory volume larger? And he was like, let's do it. So we just kind of put our heads together, came up with this formulation, and really just launched it as a pet project. And then it was, way more popular than we could have even anticipated, both in our patients that we were seeing and then, customers when we started selling it through our website. Yeah. And then we were kind of faced with like, okay, do we want to just be this one product or do we want to use our knowledge and expertise to build a company that could potentially provide people with like accurate information about sexual health and wellness, right? And so that's kind of where we've transitioned. And Brian, my business partner, and I individually have been on our own sort of fertility journeys. And so it made a lot of sense that our next product would be a fertility supplement. Brian is very open about having had both of his children through IVF. I'm currently in the surrogacy process. And so we recognize, and we knew these numbers about declining sperm counts and all that sort of stuff. And so we wanted to make sure that our second product was addressing this fertility issue and specifically targeting men because, fertility is too often attributed to women and labeled a female problem. And so we wanted to kind of empower men, especially younger men, right? Before they're even ready to have a family, to be proactive about, optimizing their fertility potential, basically.
For sure. I mean, I guess I'll back up. Is there any science or data behind the bigger the load, the more sperm count, isn't it?
Usually volume is a predictor of more sperm, but not always. I mean, you can definitely have like a normal volume.
And have a higher sperm count.
You can have a normal volume and a higher sperm count, but you can also have normal volume and like no sperm. Yeah.
Right.
So the things that we look at in a semen analysis that are the most important are counts and volume also, because that's how you get the concentration, right? So concentration is also really important. And then besides that, motility and morphology and that kind of stuff. But
so what is in semen?
What is in semen?
Yeah. What is semen consist of?
So it's the fluid is mostly made in the prostate and the seminal vesicles, which you could think of the fluid as sort of like the nutrients that the sperm needs, right? So it's got like the sugars and the proteins that help nourish the sperm as they're making their way to the egg. The sperm is made in the testicle, and then it like travels along this little highway called the vas deferens and ends up in the ejaculate. But the seminal fluid includes the fluids made in the seminal vesicle and prostate and the sperm.
So interesting. And I didn't know this, but when I was like, oh, I need to work on my sperm, I was like, okay, like a week or two and I'll be good.
Right.
And I was like, I learned it takes 3 months
Yep.
for a sperm to be fully like ready to go.
Yep. Yeah. From like production to like it's ready for prime time. It's about 3 months. Yeah.
You just assume, because you're talking about millions, right?
Right.
You just assume that it's like quick
Yep.
and rapid, and
Yeah.
that was sort of mind blowing to me.
I mean, I think anything that involves like hormone manipulation or relies on hormone health, it takes weeks to months to kind of correct that. And that's true for like when we put patients on treatment a lot of times. I will put them on a hormone treatment and see them back like 6 weeks later.
Yeah.
And, tell them that it might take that long to kind of see the effects, because these things just take a while.
Yeah, it took me, I did 3 months, and then I got my numbers retested. And then at 6 months, I refroze.
Yeah.
Because it took me 6 months to get him to a number where we have the same doctor, and he's been on this, and he's great.
Yeah.
Dr. Ringler was like, cool, we're good to freeze that.
Yeah, he's great.
So he's
very, very matter of fact, Dr. Ringler.
Yeah. So I want to talk, more about the language that we use when we have these conversations. And, sometimes it can be, funny, but in particular and on all of that. But what, in your experience, can be improved upon in the way that we communicate with our friends, where we have these conversations that actually can be beneficial and less, gimmicky and gamey?
Yeah. I mean, I think there's a time and a place for euphemism, right? Like maybe not using the clinical word penis, not using the word vulva, but those are really important words. So like, I think, and a lot of people don't understand their anatomy. I mean, most guys know what a penis is. Most people know what a penis is, but like when you're talking about female anatomy, for instance, right? So many people just refer to the female genitalia as the vagina. That's like, nope, that's not the part that's outside. That's not the clitoris. Like that's just the internal part. And it gets used as this like blanket term when very oftentimes that's not what someone is meaning to describe.
Yeah.
And so, in my practice, I use those anatomical words, but also, I'll sometimes just like in the middle of a conversation with somebody that I'm talking to about their erectile dysfunction, use the word dick. You know what I mean? And I think for a long time I was like, is that too, casual? But I think one of my goals, and I think one of my strengths is helping disarm people, because people are so nervous when they're seeing me, because these issues carry a lot of shame with them. And so whatever I can do, even if it's using a colloquial word to describe their anatomy, it just helps them feel a little bit more comfortable, almost like they're talking to a friend, but a friend that's going to help them fix their problem, basically.
I love that, because it humanizes the whole process too. When you go into the doctor's office, it's hard to have those conversations. But then when you're like, oh yeah, you're just like me. Yeah. You're another human being, and you just happen to, be a professional in this lane.
Yeah.
What, and this might sound somewhat of like a stupid question, but erectile dysfunction as a whole, I think I understand the concept, but is there different types of erectile dysfunction?
Yeah.
Okay.
Yeah. So the definition of erectile dysfunction is basically like a consistent inability to either achieve or maintain an erection. So, and that's a pretty important distinction, because a lot of guys are like, well, I can get hard, so I don't have ED. And I'm like, well, do you have trouble maintaining your erection? Yeah. Well, then you have erectile dysfunction. So that's kind of where we start. And then my job is to figure out why they're having that problem. So from a physical standpoint, you can have low testosterone or some other hormonal issue that can negatively impact your erections. We do a vascular assessment in my office. So obviously your blood flow has to be normal for your erection to work. And so we do an ultrasound called a penile Doppler to like look at people's blood flow to see if they have a blood flow issue that could be causing their ED. And then, I'm not a mental health professional, but always kind of touch on psychological factors that can play a role in erectile dysfunction. And try to figure out, do I think that's a significant component of their problem? Because the reality is, for most men, it's going to be some component, right? Like especially if you're a younger guy and like you're having problems performing, that's going to carry over into future encounters, right? And so you're going to be in your head a little bit. And so I try to normalize that for patients. I'm like, listen, it's totally normal if you're having a problem to have some psychological anxiety about that. And my job is going to be to figure out what the physical stuff is, fix that for you. And if we need to provide you a referral to a therapist to kind of work on that anxiety, I'm happy to do that. But a lot of times if you find a physical issue and you help somebody overcome that, their anxiety starts to slowly dwindle, because then they start having more confidence, like, oh, I have this problem, but the doctor's helping me fix it, and now I can start performing the way I should.
Totally.
Yeah.
I think so when people come in, and especially with your product, is the main reason just for better orgasms that they want to be on it? Or is there other I mean, obviously I know there's more benefits too, but is that the main primary audience that wants to get on it?
Yeah. So it's an interesting way that we ended up there, right? Because when we decided to put this product together, it really was from a pleasure standpoint. It was like, how do we make people have more pleasurable sex? But the scientific literature is lacking when it comes to pleasure and ejaculatory volume. It's mostly related to reproduction. So we put together the initial formula for our volume and taste enhancer based on the reproductive literature. Like, what substances do we know that have been studied that increase volume for this, fertility study that was done? And then when we put that product together, we had a lot of patients that were and customers buying it for pleasure. But there was a subset of people that were saying like, oh, will this help me get pregnant? I have low sperm count. Will this? And the reality is some of the ingredients in that initial product are supportive towards sperm health. But that was sort of the first like crack in the door that we were like, wait a minute, there's this other need that we're seeing from people. And then, like I said, we both have kind of been on our own fertility journeys, and we're like, this just makes so much sense. Like, let's make a dedicated fertility product. So now we have both, right? Now we have people can choose one to increase their reproductive potential and choose another for pleasure.
Yeah, I think, and that's what's so interesting, and why I wanted to do this episode is just because we are taught to carry such shame around sex as if it's like this. I mean, growing up in the Catholic Church and stuff, as it's like this thing you're not supposed to do until you become an adult. And then, but it's just so interesting to me, because I feel like people are so hypocritical because they want to judge and tell you all about this, but then everybody does it behind closed doors, but they don't want to talk about it. And you're not supposed to.
Right.
And it's such a double standard. And it's like, how are we supposed to learn and educate, but you don't want to actually like admit that you're doing it for pleasure, and like there's a fun part in this too. It's just,
I mean, that's the irony. It's like everybody is doing it, right? Like everyone is having sex. I mean, there are some people that identify as asexual who choose not to have sex, but for the most part, everybody is doing it. And it's just like so crazy that there's such a stigma around it.
What percentage of the population do you think identifies as asexual?
I don't know that there's numbers on that. I would guess it's pretty small.
I only asked because at one point I was just desperately confused too, because I had no sex drive. Later I found out it was because I had low testosterone. But like I just, and because I was also closeted at the time, so I was like, maybe it's that. I also, it was a whole lot of things, obviously psychologically too. For me, it was just a mind maze to figure it all out.
I've been there.
Is there a product, because I did a lot of research too, because at one point I thought I had ED, and I thought I linked it to is it finasteride or is that Propecia?
Yes.
So one of those, are those supplements for men's hair?
Yes.
Linked to ED?
Yes. Yeah.
Is that the number one cause when you have patients come in?
It is a common cause. Yes. So that medication, Propecia, the generic is finasteride. When it was first brought to market, it was marketed as a medication that shrinks the prostate, right, for older guys who have prostate issues. And then they reformulated it to a smaller dose for hair loss prevention. That medicine works by blocking an important hormone called dihydrotestosterone, DHT, which is essentially like the end product of the testosterone pathway. So like everything that you associate with testosterone, like your libido, your energy, your erections, your mood, all the things that testosterone does in the body are mediated through DHT. So when you take that out, you can have all of the symptoms of low testosterone without having low T. So like in those guys, if you measure their testosterone, it's usually normal or healthy. But if you measure their DHT, it's usually really low. And so the reason that it's a really terrible medication is that the data from the initial trials that got it, approved I think it was like 3 to 4% had sexual dysfunction, but those were a lot of times in like older men. We don't, you're talking about old guys in their 70s and 80s. They're probably not being asked specifically about their sexual function. Right. So, I can tell you in my practice, the rates of sexual dysfunction from the medication are much higher than that. So I see a lot of patients on finasteride. We try to get them off of it. If they're having problems, sometimes we have to put them on other hormonal stuff to kind of counteract the effects of that medication. Yeah. But it's tricky because a lot of people really like the hair effects. I mean, I don't discard that. I mean, I understand why people take the medication, but at the end of the day, I try to bargain with them and I'm like, well, why don't we put you on like minoxidil? That's probably a safer medication that might not be as effective. But
is that topical? That's a topical one?
They actually have an oral minoxidil. Okay. Yeah. So minoxidil is Rogaine topically. Yep. But the oral pill is like a really old blood pressure medication. Okay. That you can take in a lower dose that doesn't affect your blood pressure and can help prevent hair loss. But it doesn't screw with your hormones. It doesn't have sexual side effects. So we try to transition to people to that and help them fix whatever issues they're having. But you can have erectile dysfunction. It can cause decreased penile sensitivity. It can cause low libido. It can cause like cognitive dysfunction. Guys will describe like brain fog on the medication. Wow. So it can have a lot of negative effects on the body for sure.
Well, yeah. I mean, I think you partially just answered my follow-up to that is with a smaller prostate for gay men, does that equal less pleasure from being on finasteride or propecia?
That's a good question. That would be a great study to do. I'm not. I'm
just
not really sure because I don't know that prostate size necessarily is correlated with pleasure. Okay. Because every man's prostate will grow.
I just assume will grow. Like, I guess that's me being naive, but like the bigger, the easier it is to like hit and find.
Yeah. I mean, I think it's about like direct stimulation. Because certainly, plenty of younger guys with prostate smaller than guys in like their 60s and 70s have like very pleasurable sex from prostate stimulation. So I don't think that it's necessarily correlated with size. Okay. But I mean, that would definitely be an interesting study to do.
What is a prostate technically part of the reproductive organs?
Yeah.
Okay.
Yeah. It's basically solely a reproductive
and it's only in men. I know that from my anatomy and physiology classes in college.
Although there is like a female equivalent, like the G-spot that you hear about in like magazines and stuff is essentially the female prostate. It's like the glandular, embryologically, like the same tissue. So in the same way that G-spot stimulation in a woman can, increase pleasure, prostate stimulation in a man can increase pleasure as well. Yep. So they're both kind of like erogenous organs in that way.
That functions are still, all over the board.
Yeah. Yeah.
It's so fascinating just because I think we're in a new era now with the digital age that I think is this generation is doing a much better job of sort of destigmatizing, delabeling things and making things do better, which I think, your content is is proving that, right? Like it just is like people want to consume, they want to relate and they want to like figure it out. What would be your 3 tips and advice for people who are entering into their parenthood on how they can prepare to have a conversation like this, once they feel like they want to sit their kids down
with their kids? Yeah. I mean, I'm not a parent yet, hopefully soon, but I think having those conversations early is so important to destigmatize that, right? So like the reason that people grow up feeling shame around sex or embarrassment is because no one's talking to them about it, right? So it can start, if you have like a 2 or 3 year old and maybe you have another one on the way, explaining to that older child like how babies come into this world, right? And for people like you and I who have families through IVF, like explaining that process and what that means. They're not going to understand everything. Yeah. But the kids are pretty smart, you know, and they're intuitive, and even those conversations, I think, allow them to kind of understand that sex is not a bad thing. Sex produces life. Yep. So I think that's a good place to start. And then, my parents had a conversation with me about sex when I was I thought I was way too young to be having it.
What age was that? Do you remember?
I was between 8th and 9th grade. I was about to start high school.
I think that's an appropriate time.
Yeah, I was not, I was also gay and kind of not understanding what that meant. Yeah. but also like really horny and didn't want to. I was just like, I don't want to talk to you about this. But my parents have always been like very open with me about that kind of stuff. And they were right. Like they had this conversation with me before I started ninth grade, and by like the end of ninth or 10th, I don't know, hopefully my parents still listen to this, but like by 10th grade, I was having sex, and they basically said, you're going into high school. We know that you're going to have sex. We know that you're going to drink. These are the things that we want you to do to just protect yourself. Like we'd love to buy you condoms just so you have them, you know, in case the opportunity arises,
right?
You know, or if you're going to drink, please never drive. Like you can call us anytime.
Yeah.
We'll come pick you up. And so, you know, I'm pretty thankful that I had them as parents.
Yeah. I mean, sounds like perfection.
Yeah.
How they handled it.
Yeah.
Too.
So I'm going to hopefully try to model that, I guess. Yeah. I had a good example.
Yeah. So why do you think educators and our teachers are somewhat unprepared? And I asked this question. I'm like, oh, because I just listened to you say you spent such a small amount of time and this is your profession.
Yeah.
Even talking about sex ed.
Yeah.
So it's like, how are these teachers that are PE and or sex ed teachers supposed to teach a class when they didn't even get a proper training on it?
Yeah. Yeah.
So it's so fascinating to me that you're putting these people in a position to have to teach something that they don't really teach.
Right. Right. Well, I mean, like in my high school, our sex ed, it was like health class. That's what it was like also our PE teacher. So I'm like, why are you like the same person that's teaching me like how to play basketball, teaching me like how like the reproductive tract works, right? Like that seems odd. But then also, I mean, what I thought about when you were asking that question is like some teachers don't even have the option because like they might live in a state where you can't even talk about sex in the education system, or maybe, you know, going back to like talking about LGBTQ plus individuals, like they can't even say gay or refer to, you know, kids who have same-sex parents, let alone talk about same-sex, you know, sexual activity. Yeah. So, I mean, I think we're in a weird time right now where there's like a big backlash against anything sexual as it and having those topics around children, which is so silly to me because it's not indoctrinating them in any way. It's teaching them about life. And so, I don't know.
I think, and that's my part too, is where it kicks in and being like, this is why it's dangerous to, you know, have bills like the Don't Say Gay bill, where you literally physically cannot teach and say something that could potentially be very dangerous and could end somebody's life if they don't handle certain situations properly. Yeah. You know, we do all of these drug courses and we talk about the dangers of sharing needles and DARE and like don't do drugs and all this. And they almost sort of take a similar approach to sex where like, just don't do it. And it's like, that's not realistic. Yeah. These are kids and young adults finding their way through puberty. Yeah. They're naturally going to be curious on how to handle this. So that's, you know, not being able to have that education and also the ability for teachers to like educate gay men and women out there of the risks. It just doesn't seem right.
I know. It's scary. I mean, I think, it's just it's a scary thought to be like a queer kid in, you know, maybe a state that's passed one of these laws. Like I just feel for them because it's like it already can feel. I mean, I grew up in and around the LA area. California is, you know, very progressive, very liberal. I feel very fortunate to have grown up here, and my parents have always been very liberal and progressive. And I still felt alone a lot of times as it related to my sexuality. So, you know, I can't imagine not removing all those things, supportive parents, community, and, you know, a state that is generally supportive of queer people. It's just, it's sad.
Yeah. Well, switching gears, you just opened your new location in it was West Hollywood, right? Or Beverly Hills?
It's West Hollywood. Yeah.
West Hollywood. Yeah. Congratulations.
Thanks.
And is that, you're carrying all of your products there as well too, right?
Yeah. Yeah. So we have both of the Popstar supplements available at the office if people are interested. And, you know, I talked to them about all things sexual health. So if that comes up and they're like, oh, actually, I do have this ejaculatory volume thing, or I am interested in having kids, then they have the supplement there at their disposal.
That's incredible.
Yeah.
What other topics, when as a urologist and somebody who comes in, what other topics or causes are they typically coming for your patients?
So if it's not sex health related, going back to the prostate, so like urologists generally manage all kind of urological issues. So that's like trouble peeing, that's kidney stones. Yep. I don't do cancer, but we manage like prostate cancer, bladder cancer, that kind of stuff.
Okay.
So for my patients that don't see me for sexual health issues, it's a lot of that. Like guys, as they get older, because their prostates get bigger, they start to have trouble peeing.
Yep.
So we help them with that. And then I think I'm kind of uniquely positioned because of my focus on sexual health to make sure that we're not putting them on any medications that like finasteride that could negatively impact their sexual health, while also still addressing whatever their urinary complaints are. Yeah.
So it's all medicine focused and not your practice is all focused on the medical side of things and not on the
surgical.
Yeah.
So I do surgery. Okay. My practice, because it lends itself to mostly sexual health, not a lot of that is not surgical.
Okay.
But we do prostate surgeries to like help people pee better.
Right.
And like, I mean, we can get into this, but penile implant surgery for guys who have like medication refractory erectile dysfunction.
Can people who have penile implants can they still get pregnant, like ejaculate and have sperm?
Yeah. So the penile implant device is basically like a hydraulic device. It's like you pump it up basically to get an erection, and it just gives you a rigid erection. So you ejaculate the same, orgasm is the same, all of that stays the same. It's just like for guys who can't get an erection and they don't respond to the medications that we typically use for it.
Okay. Yeah. And the pleasure stays the same too, or wow.
Yeah.
So interesting.
I know.
So what's next for Popstar?
That's a good question. I mean, the sky's the limit. I think we have a couple products in the pipeline. We basically just want to use the brand to educate people and provide solutions to whatever problems we're seeing in our practice. So Brian and I are, we run this company, but we're also urologists that work, every day, and are basing the products that we develop on real patient issues. So we'd love to develop like a testosterone supporting supplement for guys who, maybe have low normal T, but don't really want to be on a medication. We ideally would love to develop like a libido product to help people with low sexual desire. A lot of women who have low sexual desire don't necessarily want to be on a medication and might want a more holistic option. So that's hopefully in the pipeline. And then just continuing to do work around pleasure. So we're going to hopefully launch a lubricant soon because we're about just helping people have better, more satisfying sex. So whatever products we can come up with to help that happen is
well, you guys are both already doing a great job, and it's so authentic too, because you've shared, you guys are on your sort of path to parenthood too. So who better qualified than two people who are doing it themselves too, to just sort of help out. Well, incredible. Before you go, can you please leave us with some advice? It could be a quote, a saying, anything.
So I think what I tell my patients, or I guess the advice that I would give to people is, if you're not having what you would consider satisfying sex, for whatever reason that may be, first of all, you're not broken. There's nothing inherently wrong with you. That happens. And there's usually a solution to the problem. So the trick is talking to someone, figuring out what the problem is, and having them help you fix that problem. And the next step to that is, if you have talked to somebody and someone has dismissed you or not offered you a solution, then call my office, right? Or see someone like me if you don't live in Los Angeles. I wish there were more providers like myself who have like a special focus in sexual health. There are, a handful of people around the country, but it's not much larger than that. So, if you're not getting the solutions that you need, then find someone who can get them for you.
I love that. And I think just from, our time here, it's like, it can be intimidating and scary and nerve-wracking, and there's so much shame wrapped around not only fertility but sex, especially sex. Just everybody consumes it and does it, but nobody wants to talk about it and get into it. So it's a sort of a nerve-wracking topic to bring up to your doctor. But so many doctors need to sort of have that door open and sort of encourage and try to get that out of them.
Yeah, I think doctors need to do a better job.
Well, you're doing an incredible job. You're doing amazing work.
Thank you.
What is it's popstar.com?
Popstarlabs.com.
Popstarlabs.com. So for those of you out there who are interested in looking for bigger loads and or, fertility,
Yeah.
popstarlabs.com.
Yeah. Or if you just want to learn about sexual health topics, we have a blog there with we try to do it in a humorous, kind of funny banter, but teach people about sexual health topics.
It's so important.
Yeah.
It's so needed.
Yeah.
Well, thank you for joining me.
Yeah. Thanks for having me.
That is a wrap on Daddyhood.
Awesome. Thank you.
Sweet.
The ride of your life is daddyhood.